Hello everyone, welcome back to my channel. Today we are going to be talking about a topic that is very important but usually not talked about. That is vaginal discharges. What does the color, consistency and order of your vaginal discharge means to your health? If you ever had a question or a concern, stick around. I'm here to provide some clarity. Welcome back. I am Aisha Ture, a registered nurse, a dispenser, and a pre-med student. Do you know there are normal vaginal discharges throughout your menstrual cycle? But let's first talk about what vaginal discharges are. Vaginal discharges are fluids produced by glands in the vagina and cervix, and the purpose of these fluids are to wash away dead cells, bacteria from the vagina and the cervix, keeping it clean and preventing the same infection. However, sometimes there may be change in color, consistency, or odor of these discharges due to medical conditions or hormonal imbalances or overgrowth of these same bacteria or fungus that the fluid is supposed to wash away. Now, talking about the difference between normal and abnormal vaginal discharge. Normal vaginal discharges usually happen throughout the menstrual cycle, and it may vary in characteristics due to hormonal imbalances. During the beginning stage of the menstrual cycle, which is the menstrual phase, this period is when you are menstruating, when the menstrual blood is coming out. The color is usually red or brown, like the menstrual blood, and the consistency may be liquid or clot, and then the odor is usually odorless. Menstrual blood should be odorless, unless there is something else, but it should be odorless. And then during the middle stage, which is the ovulation phase of the menstrual cycle, it's usually characterized by a sticky, slimy vaginal discharge, which is usually odorless as well, and may increase as time goes on. Getting to the end of this phase, the stickiness and the stamina of the discharge may reduce, and then the color may become creamy. The last phase of the menstrual cycle, which is the premenstrual phase, or the stage before you see your menses again, is usually characterized by whitish or mild yellowish discharges, which is usually odorless as well, unless it varies from individual to individuals, but usually it should be odorless as well. Now, moving on to abnormal vaginal discharges. Abnormal vaginal discharges may arise due to variety of reasons like infection, hormonal imbalance, or other medical conditions. When you see a white, clumpy vaginal discharge, which is usually like cottage cheese and accompanied by itching, redness, or burning of the vulva, which is the outer part of the vagina, the part we see, is usually an indication of yeast infection. And when you see a gray, whitish kind of discharge, which have a fishy odor, and there is itching or burning during urination, or there is this fishy smell after sexual intercourse, it may be an indication of bacterial vaginosis. Bacterial vaginosis is a bacterial infection that affects the vagina. This is a whole topic on its own. And then when you see a yellow, greenish discharge, which is usually accompanied by itching with a very foul smell, and then there is burning during urination, it's usually an indication of trichomoniasis, which is a sexually transmitted disease. And if you see this yellowish greenish discharge become very thick, and then it's increased in amount, it may be an indication of other sexually transmitted infections like gonorrhea or chlamydia. But these gonorrhea and chlamydia are usually asymptomatic in female. However, it may cause bleeding between periods, like when you are not supposed to menstruate, you see your menstrual blood at that time, and then it may have a foul smell, and it may cause burning during sexual intercourse. Some of the abnormal vaginal discharges. However, you have to know your body and listen to it. You have to know when there is changes in your body. Individual varies when it comes to diseases and management. Everybody have the way they manage, the way their body responds to diseases. In someone, something that may be a bacterial vaginosis may be gonorrhea in someone else. However, you should know when your vaginal discharges are not normal. I hope this provides some clarity to you about the normal and abnormal vaginal discharge. When you should see them, what order or color you are supposed to see, if it is normal or abnormal. The popular question I usually hear: Nurse Aisha, when should I see a doctor? When should I go to the pharmacy? When should I start to take medications? When there is a significant change in the color, the odor, and the amount of vaginal discharges. Like I said before, as an individual or as a woman, you should know yourself. You should know when there is something wrong. So when there is something wrong, you should know that, oh, or a healthcare practitioner, or start to take a treatment for whatever is happening to you. Thank you for watching. If you ever found this video helpful or interesting, please subscribe, hit the notification bell so you may be informed whenever I post a new video. Thanks for watching. See you next time. If you have a question, please drop it in the comment below. We like to hear from you. Or if you want us to cover a topic, you can leave it in the comment below. Thank you. Bye.